50 years of service and commitment to the Coudersport community has evolved the Charles Cole Memorial Hospital into Cole Memorial, procuring the vision and legacy of Mr. Charles Cole by building a comprehensive healthcare system dedicated to serving all members of the community.
We're at a special time in the history of Cole Memorial. There are people in the community that can remember Charles Cole and his vision to have a modern hospital in north central Pennsylvania. And it's been a quick 50 years for this organization. We're very proud of what we've built here.
The story of Charles Cole is one that is anything but ordinary. Born and raised in Coudersport, Pennsylvania, Charles worked hard and humbly as he quietly built a legacy that would change the lives of so many in his beloved community.
I understand he went around with a local doctor and when he made house calls out in the countryside. And he was shocked to see how people were not being cared for.
Before his passing in 1961, no one knew of his fortune and success with IBM. In his will, it was discovered that a sizable sum had been earmarked for the construction of a new hospital.
In his will, he said he wants a hospital built that would be serving the people of Potter County and enough money to be left over to care for those who couldn't afford to pay. So that was set up in a trust.
It was Charles Cole's bequest that really, I think, made it possible to have a pretty modern, up-to-date facility and be able to attract the kind of providers, physicians, and later ancillary providers, to try to achieve the level of health care that the directors felt the area deserved.
Charles Cole had left behind his vision for creating an innovative and modern facility. And after years of planning, building on the new hospital began.
The owners of the property from the original land purchase were the Blosses, and they had a home in the front yard. The emergency room entrance and the exit from the parking lot went around their home with a guardrail in the backyard.
How did that work for them? I mean, they had plans to move at some point, right?
Didn't bother them at all. They had a small home there, and
a lot of people came to visit.
Right.
When we broke ground in 1965, this was just a big open field that we acquired for $20,000. And I remember at the time being discussed that with breaking the ground for the new hospital, this not only would give the county and Coudersport a medical facility that would be very much needed and used in this area, but it also would have an economic impact. And you can see that today if you look at the campus with the structures that have been built and everything that has evolved here with added services. And I think the hospital is one of the major employee, if not the major employee of the county.
For Charles Cole, it wasn't just about building a hospital, but providing a service to his community. The mission to together optimize the health of individuals and communities remained as a thread through the 50 years the hospital grew and developed.
The campus itself has grown tremendously. I mean, when I first came here, there was a private home in the front yard of the hospital, which is, was kind of unusual then. Of course, since then it's gone, but at that time the medical staff was probably a quarter of what it is now, and the number of employees was probably a quarter of what it is now. When
I got here in '74, the emergency room was covered by the medical staff of the hospital on a rotating on-call basis. There was not a physician in the emergency room 24/7. One of the biggest things was when we actually started staffing it with emergency room physicians. Before that, you might get a family practitioner, OBGYN.
They all took their turn.
Everybody on the medical staff took their turn. And
Today it's much different.
It's very much different.
Charles Cole's original vision has evolved into the state-of-the-art facility you see today. Cole Memorial in the past 50 years has added features such as primary care, ambulatory diagnostic testing, invasive procedures, therapeutic services, home care, hospice, and so much more.
We believe we are honoring the vision and the wishes of Mr. Cole by keeping this organization modern and relevant at a time in which this industry is changing dramatically and how medicine is practiced is evolving continually. So we think he would be proud of us and would be proud of the organization that he certainly was responsible for creating.
I'm very proud of what's happened here at Charles Cole. Now we call it Cole Memorial, but I'm very proud of what has happened. It's provided a great service to the county, health-wise, and also as an employer of many people here in the county. I think it's been a huge success.
What we focus on here is making sure that every patient and their families have an excellent experience, because that's something we can do every time someone walks in and trusts their care to us. So it's all about the experience, and we talk to our staff and we train our staff continually on the need to make sure everyone is welcome, feels safe, and has a wonderful experience.
When Mr. Cole envisioned a hospital in his hometown, it was meant to improve the lives of people living in this region. The strength of Cole Memorial has always been its ability to anticipate and change as the times have dictated. This holds true today, and the envisioned partnership with UPMC will help assure that Charles Cole's legacy lives on the modern health system today that bears his name. Soon, those who remember the origins of Cole Memorial and the first-hand stories of Charles Cole and other key contributors will vanish as they retire, taking a part of their history with them. Those who have and will continue to come after them must carry on the legacy of Charles Cole, and for those that came before. They will have their own history to write as they create it.